Will spinal flow actually help and actually provide relief from sciatica and back pain? You'll find out in this video. Here's an overview of what we're talking about. We're just going to jump right in. So let's start out talking with what is spinal flow. We're going to talk about its roots in chiropractic science because it really is rooted there. Discuss whether spinal health impacts, like, what does that have to do with the price of beans, right? Like, how does what's going on with your spine impact everything else in your body? We'll talk about how it does. Then we're going to key in on your specific biggest concern right now. It doesn't mean it's your only concern. It means it's likely your biggest concern right now. Chances are you are at the level where you're thinking about sciatica, you're thinking about your hip pain constantly or nearly constantly. Like, it's impacting your daily life and you want to figure out how to get some relief from it. I know I've been there, not with sciatica and hip pain, with many other health symptoms. So I understand, like, the thought process there. All right, so we're going to key in on that in particular after we set the stage, lay the groundwork. And then we're going to talk about how spinal flow supports the body in overcoming chronic pain. And lastly, whether relief is really possible without surgery. That's the big question, right? Let's get into it. All right. Spinal flow was developed by a chiropractor after years of working with patients at the Texas Back Institute. So Dr. Carly Axford, actually, all right, just to lay this out, the Texas Back Institute, at the time that Dr. Carly Axford, the founder of Spinal Flow, worked there, prevented 85% of surgeries. 85% of surgeries by focusing on alternative therapies. Okay, this was back in the day before Dr. Carly had developed spinal flow yet, just to give you a context of the power of these alternative therapies. So, chiropractic science, at least one sector of chiropractic science, sees the spine as the most important organ in the body because when vertebrae get misaligned within your spine or slightly compressed, so these are all joints, and even slight compression, it restricts the ability of the nerves that are exiting between these vertebrae to transmit signal. Here's how. All right, this is a visual of your nervous system. So what you see here, of course, is the brain connected with the entire spinal column. And then what you see exiting between these vertebrae are nerves. So both in yellow and then in green. So one represents nerves that control the sympathetic nervous system and nerves that control the parasympathetic nervous system. And with that, like, we start to see how if there's compression or slight misalignment, so slight torque between vertebrae, all of a sudden we've got extra resistance on these nerves. Now, here's what that looks like. This is where it's kind of nice to step into the realm of, for anybody that's an electrical engineer out there or an electrician, even, where we talk about in terms of resistance. An easier way for most of us to think about this is to think about a garden hose. So when you provide resistance to that garden hose, you are restricting the flow of water. And it is such so that you can restrict it down to a trickle. So I'm not just talking about sticking your thumb on the end and making it spray everywhere. I'm actually talking about compressing that hose, restricting it. Because if you fold it in half, you're able to stop the flow entirely. And this is what's going on. If you imagine, these are how vertebrae should be. This is the appropriate amount of space between those vertebrae. Okay. And this allows for easy transmission of nerve impulses. But in regions of the spine where we have compression of these vertebrae and we have less space between the vertebrae for those nerves to sit, for those nerves to transmit, because once again, nerve transmission is electrical. So if you've got compression, you've actually got bone interfering, and all of a sudden that bone is providing resistance. You've got the cartilage, you've got the disc, that like the cushioning in between those vertebrae, providing resistance to that nerve impulse and actually soaking up some of that impulse so that it's not able to get to the organ, to the tissue, to the cell where it's needed in a timely manner. And the full expression of that impulse is not able to get there. So this is what we've got going on within our spinal column when there's compression between the vertebrae, when there's slight misalignment between the vertebrae. Okay. Now, moving back over to the spine, let's talk about where sciatica, where hip pain is located along the spine, like where we can expect to find some sort of compression, some sort of blockage in the spine. Now, with spinal flow, we actually have an assessment for each one of these areas of the spine. This is part of what Dr. Carly developed as spinal flow assessments for each one of these regions. So when we're talking hip issues, sciatica, lower back pain, what we expect is when clients come in and we do these assessments to find blockages here in the sacral region of the spine. Okay, and we do that through palpation. We do that through actual like small activities, small actions that a person takes. And then we assess for blockages or compression in this area. Okay. And once again, this is nerve compression, because what you will notice is in the sacral region, all of these vertebrae are actually fused. So we're still looking for compression of these vertebrae despite the fact that they're fused. Okay. Now, in spinal flow, and once again, in sectors of chiropractic science, especially network spinal analysis, the spine is viewed as the back of the mind. So what this means is that when we experience physical stress, when we experience chemical stress, and here what I mean is like when we overindulge and the body can't handle it, or we're stressed out and we eat and the body can't handle it, or even when we're sick, like especially, when you have a cold, when you have the flu, like when you're just feeling kind of under the weather, it's very common for the toxins from those bacteria. And even as the body is healing, if anybody out there has ever heard of Herxheimer reactions, like those are toxins from the bacteria. Bacterial breakdown as they start to be cleared out of the system, the bacteria themselves as they are living in our bodies while we're actively experiencing symptoms of an illness. Those toxins, because the body can't handle them and process them real time, actually get stored in the back of the mind, which once again, according to spinal flow and a sector of chiropractic science, is the back of the mind, or is the spine. Okay. And then emotional stress is the other one. So once again, anytime we are dealing with something and we just can't handle it, it's like, the body says, I'm going to store it there for her to deal with later. Okay, she can take that on later when she has more bandwidth. Any of these that are too large for the body to handle at once, and here, like, we live in a day and age where we're all stressed. Like, yeah, we're all stressed. There are too many demands on our system. There's like, we're too much junk in the food we eat. Even try as we might to eat as clean as possible, there's still too much junk in the food we eat. There's too much junk in the air around us. New building syndrome, car exhaust, like the whole gambit of stuff. Fluoride in our water. Yes, I'm one of those people. And I should mention I'm a pharmaceutical research scientist, so I've done my fair share of research in this. I live with Hashimoto's thyroiditis, which is an autoimmune thyroid condition, and have pretty much self-hacked my way to as well as I am today. So I know what I'm talking about. All right. The body protects itself by shuttling that extra stress to the back of the mind, the spine, to deal with later. Where this extra stress is stored depends on you. It depends very much on your genetics. It depends on your predispositions, your body's tendencies. If you've got any previous stress that you've been hanging on to. Like for me, I tend to store a lot, and this is very common. I tend to store a lot of chemical stress in my neck. Well, at the time I was born, the umbilical was actually wrapped around my neck twice. So there's some physical stress in that area of my body as well. And this is also a location where I tend to store emotional stress. So just to give you an idea, like we're all different, where we store it is different. I truly think like the more I learn about this, um, the more I really believe that this explains so well why identical twins can express things entirely differently, because they don't have identical lives. Like, no, they may be identical genetically, but no part of it just speaks to the uniqueness of all of us, which I mean, I think is beautiful. Okay, let's move on. All right, these stressors can, as I just mentioned, they continue to layer on top of one another as we are assaulted with more and more that our system just can't handle. And as they become layered and stored, it continues to pop up as symptoms for us. And so during these spinal flow assessments, during the palpation portion of the assessment, what that's going to feel like is inflammation. It may feel like slight misalignment or torsion or compression in a certain area, like in a certain vertebra or between certain vertebrae. It may feel like just tension. It may feel like the body's just trying too hard and the muscles are just trying too hard to hold the body straight, for lack of a better word. And this is like you are spending too much. And I've met people like this. One of my really good friends has great posture, and the amount of tension, she has great posture despite the amount of misalignment along her spine. And I think it speaks to the body's ability to compensate and how incredible the body really is. That said, when this is going on, we are spending too much energy to actually, what I'm looking for here? It's like we're spending more energy than we need to hold ourselves upright, to hold ourselves in that position. And that's energy that could better be spent by the body on healing. All right. Scientifically speaking, because once again, I'm a pharmaceutical research scientist. Like I am very much into this because I have experienced the power of spinal flow myself. Like from session one, I was hooked. From session one, I knew this was different than anything else I had ever tried in my whole entire life. I knew this was different from acupuncture. I knew it was different from Reiki. I knew it was different from myofascial therapy, from basically like name it, like tapping, sound therapy, the whole gambit. And once again, I'm very much rooted, like I, I was raised by a nurse, come from multi-generational line of nurses, people in the medical field. I diverged and went into pharmaceutical research, still very much scientifically minded and Western medicine perspective or bend to a lot of what I see. So I kind of want to understand the science of it, right? So the idea behind spinal flow is to support the flow of cerebrospinal fluid up and down the spine. The cerebrospinal fluid, it serves many functions. I mean, we could just have an entire video on what all the cerebrospinal fluid does for you. The important thing from a spinal flow perspective is that it flushes waste from the spinal column. This is the brain it flushes waste from both the spinal column and also the brain, and it returns that to the lymphatic system so the body can process it. So this is really important. If we've got all of these toxins that are stored along our spinal column, by increasing that flow of cerebrospinal fluid, we can begin to dislodge those, begin to return those to the lymphatic system where the body can process it, where the body can eliminate it, get rid of it, and result in you feeling better, because that's why you're here. All right. I mentioned this previously. This is the part on, does spinal flow actually work? I mentioned this previously. 85% of surgeries at the Texas Back Institute were prevented through either traditional chiropractic care or through one of the integrative therapies practiced there, including network spinal analysis. So at this point, you've heard me mention network spinal analysis a few times. Network spinal analysis was developed during the 80s by a guy named Dr. Donnie Epstein. And it was found, I would say it was foundational in Dr. Carley developing the spinal flow method. Spinal flow is different from NSA because the access points are different. I have received both of these modalities, and I can tell you both of these, for me, function very similarly. They both support healing in my body. And a lot of it is just who's closer to you. Is there an NSA practitioner closer to you, or is there a spinal flow practitioner closer to you? And then the other one is which one, like if you're lucky enough to live close to both, then the question becomes, who do you resonate more with? Do you resonate more with the spinal flow practitioner or the NSA practitioner? So after she left the Texas Back Institute, Dr. Carley developed spinal flow. And I will tell you that the assessments that she uses for spinal flow, I have not seen practiced in NSA, at least the NSA practitioners that I am familiar with. I've not seen them practice this. So I firmly believe that the assessments that Dr. Carley developed are unique to spinal flow. Once again, the access points are unique to spinal flow. But both of these modalities are very similar. And as we move through this, because spinal flow is relatively new on the scene compared with NSA, which has been around again, once again, since the 80s, and because there's more peer-reviewed scientific journal articles published on the results of NSA, that's what I'm going to pull from to support these additional slides. So after she left the Texas Back Institute, Dr. Carley developed spinal flow because really, quite frankly, one of the things she realized, she is a trained chiropractor. And one of the things she realized as she was working on people was that what she was doing wasn't really fixing them. They were returning with the same misalignment, the same problem time and time again. And so she was really after something that was going to result in lifelong change and lifelong, like, this is a reminder, this is a return to yourself, this is a return to the innate healer, this is remembering and waking up the innate healer inside each of us. Okay. With spinal flow, real change isn't only possible, it is expected. And she tells this beautiful story about her infant son. When he was a tiny baby, he was diagnosed with meningitis. As a matter of fact, I believe he had double meningitis. And Dr. Carley started practicing spinal flow on him and started having people perform spinal flow on him. And he recovered. He was not expected to make a full recovery, and he did. And now he's a thriving, at this point, probably 20-something. The video I know where she talked about it, it was a few years ago, and he was in his teens then. So here's what the science says about NSA and spinal flow. This top one is pulled from one report where they were following people who were receiving network spinal analysis for 3 years. And benefits became very evident as early as 1 to 3 months, and they continued to increase throughout that 3-year time span. Okay, that is profound. an additional one, reduction of psoriasis in a patient under network spinal analysis. This particular one, this person was able to stop taking methotrexate. So they were taking this orally for psoriasis. They had psoriatic lesions covering 5% of their body at the time that they started receiving network spinal care. After just 5 weeks, with continued 5% stabilization, so this is still 5% psoriatic lesions covering the body, but it's not covering more of the body. This guy's medical physician advised him to stop taking the methotrexate. Okay. And then 1 week after he discontinued the methotrexate therapy, his symptoms reduced to 1% body coverage. And I mean, this is just profound. Like, this particular case report goes on to describe how this guy's life continued to change as he continued to receive network spinal care. But just in the 5 months that I mean, this is profound change. And actually, this isn't even 5 months. This is like 5 weeks. So 5 weeks to discontinue oral methotrexate, another week after that to reduce from 5% to 1% psoriatic lesions. The question is, does this work for sciatic pain? Well, this may not be a peer-reviewed scientific journal. This is one lady's testimonial. Okay. She was receiving intensive spinal flow treatment over the course of 7 days. And what she reported is how much she was blown away, as you can see in this top statement here, how much she was blown away by the transformation in her posture. And then at the bottom here, over the course of that 7-day immersive or 7-day intensive, what she experienced was no headaches, no sciatic or lower back pain. And she was able to release a lot of, or she says it's some emotions. Now, if you're not sure that spinal flow is really right for you, or might really, if you're still like on the fence about whether or not it can really help you, I mean, come on, we're talking surgery here. Can something as simple and as gentle as spinal flow really work? It's totally normal to still have questions. And that's why I'm offering a free assessment. So this is your opportunity to connect with me. We'll actually connect live and see whether or not spinal flow is a viable option for you. To book your free assessment, reach out to me at hey@theflowtoheal.com. Hey as in HEY at theflowtoheal.com. I serve North County, San Diego area. If you are not in this area and would love to try network spinal or spinal flow, send me an email at hey@theflowtoheal.com. I'm happy to help you find a practitioner in your area. Thank you so much for being here. If you know anyone who might benefit from this video, share it with them. All right, until next time, bye.